For Eric Erickson,
How are you doing?
Feeling good.
Yeah.
who lives with multiple myeloma, a cancer of the immune system,
You can notice a little maybe fuzz coming in there.
It is.
good news is welcome.
When we look at the bone marrow, we do not see any myeloma cells.
Last February, Erickson had mild pain in his back, which kept getting worse, eventually creeping to his arm.
The pain was so severe that it would actually take my breath away.
After rounds of testing, his primary care doctor noticed something on his lung, and he was diagnosed with myeloma, which requires a bone marrow transplant.
For multiple myeloma and lymphoma, we're trying to use high-dose chemotherapy to treat the disease, and we're using the patient's own stem cells to rescue their bone marrow back from the toxicity of that chemotherapy.
In the past, bone marrow transplant patients in North Dakota and western Minnesota had to travel to the Twin Cities or Rochester for treatment. The chemotherapy for this transplant basically eliminates the patient's immune system, so they also have to stay isolated in that location. But Erickson had a new option. He would be the very first patient to receive a bone marrow transplant at Sanford in Fargo.
I did know that they were starting this program up here, but it was, we all thought it was going to be after the first year and it would be way too late for me. When my doctor mentioned it, I was just like, yeah, I think I told him if it's all possible to do it here, I want to do it here.
Erickson became Sanford Fargo's first bone marrow transplant patient this October. And 60 days later, he has no detectable disease in his system, though he will be treating his condition for the rest of his life. Dr. Maliski says treatment isn't all about what is done inside the hospital, though.
I always describe to people who I visit with about my work just how much accumulating toxicity there is for our patients. And up front, people all imagine the chemotoxicity, but financial toxicity is a part of it, and time toxicity is another. It's a huge time burden to do what these patients do in treating their cancers. Being able to do this closer to home relieves that huge part of the burden on patients.
Erickson and his wife Melanie agree.
I knew this was a major event and stuff, but it didn't give us the same amount of stress as it did other people that have to be away from home.
My wife Melanie, she when I was in the hospital, she would, we're only an hour away, so she would just be able to drive here, spend a day with me, drive home, and it was nice. I think it helps you heal better too, that you're more comfortable in your surroundings.
After a trying year, the Ericksons are taking in every bit of good news they can.
You have no detectable disease.
And looking forward to a calmer 2022.
Hearing those test results was really, really, very nice to hear.
In Fargo, Jason Anschutz, Sanford Health News.